supervisor who then tells them what to do. Now that's oversimplified, but I teach more supervisors than anyone else I know across the world. And if I say to supervisors, do you worry about this? They say yes. Of course, the second question is, how are you contributing to having that happen? The point about this is that when social workers get in a muddle, and I would say this to all disciplines, it's not because we are blind to concerning behaviour. It's not the behaviour we miss, it's the meaning of behaviour. And social workers in the UK are overtrained about behaviour and undertrained about cognition and affect, which is a serious deprivation, because you cannot possibly understand behaviour if you relegate to the margins 2/3 of the human dimension, which is cognition and affect, and that leaves out the area of soul and spirituality. Some of you might well wish to include spirituality as your fourth domain, and absolutely. And it seems to me that systems of meaning are fundamental to understanding and predicting behaviour, and we have given up that ground to psychologists and psychiatrists. And we shouldn't give up that ground. Why? Because we bring the ability to see behaviour in context, particularly in family and community context, which we are almost unique amongst those other professions. How much is told by the home visit? How much is told by the walk on the estate where our service user lives? Understanding meaning cannot be done only in the clinical room. It requires a person in their environment outlook. But I'm suggesting to you that if we can't venture comfortably into the domain of emotion with those whom we seek to help, our chances of eliciting meaning are lessened. What we will do is tell them what it means to us. That is not what a system of meaning is. A system of meaning is, how is this situation construed by the person and the mind with whom you're working? Daniel Goleman, who I have a balance, I think Daniel Goleman's made some very important contributions, but I think that you need to realise, I'm referencing Daniel Goleman, he's the person who probably is most associated with the emotional intelligence movement. But you have actually in Australia got a number of people who've led on other domains of emotional intelligence. But one of the things that I think Daniel Goleman, whether he discovered it, or frankly as a journalist he quoted other people, is just a very simple idea of resonance and dissonance, which I think is very helpful. And it really comes round to who we think the self is, because the difficulty with the emotional intelligence movement is it's never dealt adequately with the question of who is the self in the self-awareness and the self-management. Because of course that's a fairly philosophical question, isn't it? If you grew up with a humanistic philosophical orientation, which many people who come into the helping professions did, you probably thought, as I did, that the self was an autonomous, self-defining individual in good kind of enlightenment type of philosophy. And then you come across Anthony Giddens and a whole host of constructionists, and you're suddenly confronted by the rather awkward notion that the self is also socially constructed. What that gets you is the idea that in fact emotions are social phenomena. They're social phenomena at lots of levels. But let's take the simplest level. You and I have all had the experience of coming into work and feeling fairly buoyant and optimism, and within 5 minutes of a work conversation, for no particular reason, feeling whoops. And you have all had the opposite experience of coming in feeling down, demoralised and defeated by whatever, and being mysteriously lifted by that same set of colleagues. And you don't know why. Nobody's asked you, how are you and how can I help you? But you've been caught up in a buoyant mood and it's lifted you. Doesn't that show how contagious emotions are? Resonance is the idea that positive emotions have a direct neurological contact with parts of the brain that lift all sorts of aspects of human functioning. We also know from the health people that signals from another person can alter hormone, heartbeat and sleep. There's a piece of research done in nursing which showed that patients in intensive care who were nursed by nurses with depressed mood died at 4 times the rate of those nursed by And apart from the shock horror of that, does it make sense? Of course it does, because when you are at your most vulnerable, your immune system is massively susceptible to the process of care and engagement. The Benner study showed how those attuned nurses could absolutely attune to a patient in their most vulnerable place. You also know in team meetings how quickly emotions are contagious. One person gets a bit angry, and before you know, everybody's angry. And nobody knows why they're angry or where it started. I say to you, and I say to everyone I train, that before we do anything technical, we need to be clear what mood we are bringing. Not just what feelings, but what mood, because mood is more pervasive. And you know that old saying about people who see the jug half full, half empty? Why is this so important? Because so many of our vulnerable clients lived and grew up in households where moods were misregulated. And what did their little plastic brains learn? Many of their very little vulnerable plastic brains learned to either cut off mood because it was overwhelming, or they learned that the only way to get attention was to exaggerate mood. Therefore, this is a group of service users who are hyper-vigilant to mood. They cannot afford to miscalibrate the mood that you and I bring when we ask them to have conversations about matters of privacy, vulnerability and liberty. It is not in their interest to miscalculate whether our mood is resonant or dissonant, because they know that on a good day, a resonant mood will lift them. They also know on a very bad day that insensitivity, or worse, even contempt or anger, and notice this, chronic futility, is a profoundly attacking experience. And in this little couple of pictures about the brain, can you see that the lightning does not strike at the top of the brain, which is the cortical sense? It doesn't even strike at the midbrain. Where does it strike? In the old reptilian brain, where our fight and flight responses are. Let's just pause on futility. It's no surprise that anger and contempt would cause that kind of disarrangement. What is interesting is futility. Why might futility, which is so passive, be experienced as such an attacking emotion? Well, the reasons lie in the chemistry that is generated when I, the service user, find myself feeling responsible for you, the service provider, because your mood is low. That disarranges the power arrangement, doesn't it? It screws up the accountability cycle, and it places a worry about if I don't please you, then you're not going to be in a sufficiently robust place to look after me. And I think we have many service users for whom that repeats a very early experience of, you see, you cannot trust adults to be there for you. I also put it to you that the withholding of psychological attentiveness is generally more damaging than most forms of hostility. Obviously, I'm accepting, brutality and violence. A good friend of mine was, 25 years experience as a social worker, went into her first supervision session with her new and experienced supervisor. And during the course of that first 45 minutes, she got to a point where she had to say to the new supervisor, look, I'm finding it very difficult on our first meeting that you haven't taken your eyes off your computer. And that really wasn't the end of it. Within weeks, this very experienced colleague was literally in tears. And I really want us to understand how attacking the withdrawal of attention is. Because actually hostility is an attempt to make contact. I'm not saying it's okay, I'm not saying it should be licensed. But it is much easier to work with hostility in the room than futility. Because futility is a near neighbour of depression. And I teach all my supervisors, don't even begin to think of the use of a technical tool if you cannot hold your staff in mind. You don't need to know what they're doing every second of the day. They must know that you hold them in mind. You are interested in what's happening to them. And supervisors who fail to do that, although they may be technically very expert, will only ever be of use to their staff in conditions of emergency. It sounds like a very simple thing to say, but I have become convinced over the last 20 years that part of the politics of withholding is very primitive. It is simply that so many managers cannot remember the last time when anyone did that for them.